these.
Okay.
So you can actually treat the whole face with the 10, and then you can go back to those crow's feet and those acne pitted areas, or the fine lines with this. So,
Okay.
and so you are going to get an aggressive treatment with some of the areas that need it more, but there's most of the face doesn't need that. So now you have a patient that is taking forever to heal. Listen, the results are beautiful, but not everybody has that kind of time or even expects that. So that's how I like it, because you can customize it with this. So maybe like I used this on my chest a couple summers ago, in the middle of the summer. It's stupid. But I'm also like in my now I'm in my late 50s. So I was like, I have sun damage and I'm wearing a shirt and no one's gonna, like, it's not my face. And it did take a good 2 weeks, maybe a little longer, for it to completely heal.
Okay.
So I was sort of regretting it. But then once it was over, I was fine. But again, I did it to myself knowing. But with doing it to a patient, you're gonna get too many phone calls. Too many panicked, like, why do I look so, because they're gonna go through a tough period. This one, they will be pretty much social downtime about 3 days.
Okay.
Total downtime about 5 to 7. So it's certainly for like the regular, everyday person who goes to work, like pretty much everyone you know.
Yeah.
Like
So,
real life people.
As far as like makeup, can you put it on 24 hours after? You have to wait those 3 days.
The most important thing with this is something super occlusive afterwards, and which is probably what you're doing with your cool peel too. So
like nectar, epidermal repair.
Something like even as basic as Aquaphor.
Okay.
So, but that's super important. That's those first 3 days, they have to like do that like it's their job.
Okay.
Constantly, because they want to trap in all that moisture. Otherwise, it really will take longer for them to heal, and then they can get a little bit of like PIH around their hairline, like the areas that take longer. They'll eventually heal, but why do that if you can heal quicker?
Yeah.
Right.
So that's really important, is that post care. And then after those 3 full days, if they're starting to kind of peel and they can start to see that they've turned the corner, then they can use some of those like the better post care products that are probably more customized and more expensive and nicer, but really we're basic in the beginning. Okay.
So Vaseline too. Sorry.
Vaseline works.
Vaseline.
And there's another product called Unpetroleum. Have you heard of it?
No.
You can just get it on Amazon, and you can even tell them about it. It will come tomorrow from Amazon, and feels just like petroleum. I don't even know what it is because it's unpetroleum, but it works.
Okay. Now with this, do you feel heat with it? Like, are you gonna? And then when you put the Aquaphor on, are you gonna feel like you're trapping heat?
Sort of.
Okay.
Yes, and that's a super great question.
Okay.
So when they're having the treatment, it's actually pretty tolerable.
Yeah.
It's really after the treatment, and then that heat builds up. So that first hour, that's a really good point. Like sometimes, like when I do myself, I do wait for like the hot to go away, and then I'll put the Aquaphor on. So wait about an hour.
Okay.
But that's also me on me. When you have patients, like sometimes it's so hard to get them to be compliant. So that's why I'm just like Aquaphor. But if you trust them to put it on when they go home, then that is a better way to do it.
Okay.
Because you're right, the heat will trap. And the first time, not the first time, but the last time I did one on myself was in January, and I put this like cooling mask on right away thinking it would be helpful. I had to take it off because all that heat was being trapped in there.
Okay.
So after an hour, I put it back on.
Like a sheet mask you put on or something?
It was like a Velez mask. I don't know if you're familiar
Yeah,
with
we
that.
do them. Yes.
Okay.
Yeah.
And I love them. They're wonderful. But again, I would send it home with them.
Okay.
So
I got you.
Aloe is okay.
Not aloe. Believe it or not, aloe is not good because there's a lot of alcohol in aloe. So you want to kind of steer clear of aloe. I did have a girl who put, I was so upset about it. So skin of color, which you can treat skin of color. I had a demo day down in King of Prussia, and she came, and our trainer, who's the head of our clinical trainer, so they don't come higher than her, was there at my demo day and treated her and said, and the girl was making like a joke. Oh, I'm gonna scare the kids tomorrow because I have to work in the hospital. Blah blah blah. She's like, but I'll just wear a mask. And our trainer said, please, you cannot wear a mask. Well, she did not listen. Wore a mask, got an infection, and went to the urgent care. Got a prescription for the infection. That part's fine. And the urgent care doesn't know what this is.
No.
And they told her to put aloe on, so she made the infection worse. So it's
Because this is like essentially an open wound.
yes.
Yeah.
Now it's safe in the sense that there's going to be no oozing. There's no pinpoint bleeding. We're only removing the epidermis. We're not going as deep as the CO2. So for my money, and I know I'm biased, but for my money, the Neo and then the Era is better than anything else out there.
Okay.
Because you're getting basically the treatment of a CO2. The Neo is going deeper than anything else out there. It's addressing all three chromophores. So your reds, your browns, and the water in our skin. Plus it's building collagen. So it's addressing everything all at once, really, really deep. Obviously no downtime. And then you throw this on top, you're fully bleeding that top layer. When they heal, it's so beautiful.
Okay.
So it really is such a great combination. But I know this kind of gets left out because it's not for everyone. Everyone doesn't want downtime, can't afford it, whatever. But if they can do both, the results are so good.
That's good to know.
Yeah.
Okay.
So,
Now, would you recommend doing this, like, if we wanted to pair it with a facial? Would that be something that would be ideal, or do you think more of, like, the Neo being paired with a facial?
yes.
Okay.
You can do literally anything after a Neo.
Okay.
The only thing we recommend before a Neo is dermaplaning.
Okay.
So literally fill in the blank. You can do anything after a Neo. This one, you could do a facial beforehand.
Okay.
As long as there's nothing on the face when you did this, but the whole idea of a facial, they leave all like glowy and stuff. So I would stick with like a facial after a Neo.
Okay, I got you. So if we wanted to do, like, I'm moving away from this just for a second. If we wanted to do like a facial with the Neo in it, could we do a facial that has a chemical peel? Okay, okay. But we would want to do the Neo first and then the facial. Got it. Okay.
Yeah, you can pair so much with the Neo and you can really customize it. So if you have a patient with melasma, the way a protocol would look for that is dermaplaning, Neo, chemical peel.
Got it.
It's such a great combo because that chemical peel is moving that melanin along. And as you know, melanin has to work its way out of the skin. So that's why a chemical peel is great with melasma.
Yeah.
Whereas like a rosacea patient, you can do a chemical peel, but their body's going to absorb all that red. So your red patients will treat quicker because the body absorbs everything, but they're also more painful. So it's like, which ones work? So the red, the rosacea, the acne, they're going to feel it more because this is so highly attractive to hemoglobin.
Okay.
But they will get pretty quick results.
Our model that we have coming in for the Neo today, she has rosacea really bad.
Good. I mean,
I'm
sorry for
excited.
her, but we're going to help her.
Yeah, I'm so excited. She's my cousin, so I'm like,
good.
she's been wanting to do something. I'm like, come in and get the Neo done.
Yes.
Yeah, it was perfect timing.
Yes. I love it. And she'll leave here a little pinker than she came, but she'll be more uniform pink.
Yeah.
And she'll be more glowy. And then by tonight,
Bailey's here.
Okay, we'll be out for in a minute.
by tonight, she'll just be glowy.
Okay,
Just glowy.
perfect.
So, and then if she sticks to it, you can get that red under control.
Yeah.
So.
That's what I was telling her. She wants to try it, and I was like, well, come be our model.
Yes.
Perfect timing. So, and she's a great person for it because her cheeks are like red.
Good.
Red. Yes.
Good. I love it. And
Yeah.
she's a good test too because she'll feel it more than you two will.
Yes.
So it's really good for her. She'll be able to give you good feedback, but she'll be able to tolerate it.
Yeah.
Really, anyone, even men, dare I say, out
Well,
loud.
I do have men that come
Yeah.
in. I have a man that comes in for his chest. He's acne down his chest, and he gets the Neo done. For him.
Good.
Yeah.
Good. They're big babies.
They are big babies,
So-
but he lays there and handles it so well.
Good.
Yeah.
But that's it. I love it. I love the Neo for men because they are babies. Be honest.
Yeah.
But they also so they can even tolerate that. And they don't want their friends knowing they're doing something, but they also are human beings and they want to look better, just like we all do. So if you can get a guy's acne under control, or PFB, or chest acne, or whatever, or just skin rejuvenation, whatever they have going on.
Yeah, because they're all against Botox for some reason.
Yeah.
I don't know why.
I don't either. It's weird.
It is weird.
So, but it's not going to replace Botox,
No,
but it will help.
Yes.
For sure.
It'll help kind of push it off for a little bit. Yeah.
Exactly. So yeah, I love it for men.
Yeah.
I love it for men. But this, especially this time of year, like people going into the holidays, if they do this, really they don't need a full 2 weeks, but that's a super safe time frame.
Okay.
If they do this before a holiday party or a class reunion around Thanksgiving, whatever, they will have that wow factor. So I love it for it, and you truly can customize it, even if you wanted to only treat someone's crow's feet.
Okay.
That you won't have demarcation lines like you will with other devices. So you can be, or just like the smile lines, like whatever.
Wow.
And then just like charge accordingly. You don't have to do a full face charge. Just charge for here
Like a
or
spot
for
treatment.
here.
Yeah.
Yes.
Real quick, Sammy, hand me the face reality cleanser. I'm gonna go give it to Bailey to wash her face. She can't. It's the big bottle. Yep. She can't use elastin. It makes her face worse. I will be right back.
Alright.
You can keep talking. Now.
Okay. So, do you have any other questions about this or the Neo specifically?
So the Aerolaze is going to be just a little bit, the Aero, that's what they call it. It's going to
The
be
era.
Aero.
Yeah.
Okay.
But if you don't know, how do you? I don't even know if it says it anywhere.
I
Oh,
know,
yeah.
it's like
It's not your fault.
Aero. Okay, so the Aero is going to be a
Oh,
little
right
bit
there.
deeper.
It's super pale that you don't see.
Okay.
So,
So that's going to be for a little bit deeper treatment.
it's
And then-
actually the Neo is the one that's going down into the deep
The
dermis.
Neo is.
Yes,
Okay.
but there's zero downtime with that one. So literally everyone who walks into this building has something on the list that the Neo can treat.
Really?
And
Okay.
actually,
I'm gonna bring my chair over.
I'm going before I leave, I would bring in I'll throw that anywhere.
Oh, this is yours. I'm
Yeah,
sorry.
I'm sorry.
Oh no, you're fine.
I will go get my FDA approval, my list
Okay.
with both the Neo and the Era, so you can see everything that they both
Okay.
will treat. But the Neo, there's over 40 different things.
Wow. Okay.
So there's a
So
lot.
like psoriasis, and I think I did see a lot of that on the videos.
Mhm.
Acne.
Mhm.
But so it goes deeper, but it's not.
So because there's no downtime, it's confusing. So it's the Neo's going to go down deep into the dermis. It's going to bypass the epidermis and go down into the dermis. So you don't numb, and even if you did numb, it wouldn't do you any good because you're bypassing the epidermis. So that's the one that's our marathon runner. That's our slow and steady wins the race, because the patient, if they only have one Neo, they'll be fine, but they're not going to get their final results, and they're going to be like, "Look, I just spend $400 for or whatever that charge is here." So you really do want to sell a package of Neos. I would say at least 4.
That's how we do all of our packages. Yeah.
Good. That's super important, and just explain to them that one, yes, you're gonna leave today glowy. We're gonna get you less inflamed today, or whatever they're in here for. But it's not gonna be enough. It's like exercising for a week and
Right.
thinking that
Yeah.
you're gonna get the final results. It's not gonna happen. So, whereas this is your Amazon Prime shopper. So this, you will get those wow results once you heal. So in about 5 to 7 days, you are going to be like, wow, like I look really good. Although we only went to the epidermis. So this is not going to last as long as the Neo. So the Neo works on the actual health of the skin. And so the Neo is your exercise. Like if you think of a bride and she's exercising, she's get her body in shape, that's the Neo. This is the wedding dress. It's going to be beautiful, but if her body's in shape, this is going to look even better. So it's the same idea. This is fine for anyone, but if you pair it with the Neo, and this maybe one, if you're selling a series, and it depends on the patient, depends on the age, depends on what they have going on. Like I'm 57, so I could use 2 of these. So if I'm coming in here for a series of 4 to 6, you might put one of these in the very beginning of my series and at the very end.
Okay.
Like that would be an amazing treatment plan. You guys wouldn't need to. Like you could just use one. Like wherever, in the beginning or the end. So it wouldn't be as important for you two. But if somebody came in here with like a lot of acne, scarring, and peeling, they could use 2 in this series. But really, 1 to 2 kind of a year. So this is why this is a more expensive treatment. So you'll charge more for this, and people kind of know that. They know that if they're being ablated, that it's a more expensive charge. It's a process with the healing. So they know that. Whereas the neo, it's a less expensive per treatment, but there's more treatment, so it ends up being about the same. If that makes sense. So did that answer your question?
Yes.
What was your question? Can I? Sorry.
Oh, yeah, we were explain if you
So
don't mind.
we were talking Reagan, right?
Sam.
I'm Reagan. It's okay.
I'm sorry.
So Sam was asking about the neo, thinking that this one goes deeper.
Okay.
So what I was explaining is that this has downtime, but it's actually just ablating the epidermis.
Got it. Okay.
So it sounds a little confusing.
Yes.
It's like
Yeah.
it's deeper, but there's less downtime. So
Yeah, and really with the neo, there's no downtime. Like you could technically do that on your wedding day.
Yeah.
Okay.
So and you'll just be glowy.
Wow.
Yeah.
And you can put makeup on immediately
Second
after.
is, yeah. There's
Wow.
there's no restrictions. Even if somebody came in and they're on Doxy for acne,
Okay.
yes, you can still treat them.
What about Accutane?
Accutane, we do have white paper studies that say you can. So what we say in the industry is as long as you're all kind of still following, and you've got so much clinical knowledge in this building, so you could probably pull it off. But if I go into a med spa that's just like has 1 or 2 estheticians, no disrespect, estheticians probably know more about skin than derms do, but they're not doctors. So I would.
They also don't
caution-
have all the coverage either.
Exactly.
Yes.
So I would caution against that, just because you don't want to mess with that.
Yeah.
So that one, I would say, it's kind of a case by case.
Got it. Okay.
But we have a beautiful before and after of a girl had very, very bad acne. So she was on a low dose of Accutane and had 12 of these, so it was bad.
Okay.
But she got beautiful clearance. So
Wow.
beautiful. And not 12 of these.
The
12 of
Neo.
the Neo.
Gotcha.
Yes.
Yeah.
So Neo is so good for acne. So it's going to work just like Accutane, where it's going to reduce the sebum production and also kill that P. acne bacteria. But the Neo is going to go so much further than that. It's going to reduce inflammation, erythema, PIH, PIE,
wow.
and also build
And all
collagen.
Fitzpatrick's.
All Fitzpatrick's.
Okay.
And build collagen all at the same time, so hopefully avoid scarring, or at least address scarring that's there. And it starts working today, not like 4 to 6 weeks from today. So it is such a great, and those patients can come in once a week. So those acne, psoriasis, and there's a few other conditions, like I don't know if you do toenail fungus or warts, but you could.
Okay.
You might not want to.
We don't. I probably don't want to touch any toes.
I'm with you on that. I have.
It doesn't work on ringworm though, right?
That is a good question.
I thought I looked that up and it said no, but
Is that that's like a fungal disease?
yeah, pretty much.
I mean, if it works on warts.
Makes you want to.
Yeah.
I'll ask.
Now I have a question. So you said it works on psoriasis, but does it also do like hair reduction?
Oh yeah.
Okay,
Yeah.
because like a lot of people that I have psoriasis in my scalp, so obviously I couldn't do my head with
You
it.
couldn't.
Okay,
Yeah.
I got it.
Yeah. Yeah. That unless somebody's bald. But
Okay.
it does do a great job for psoriasis.
Okay.
So I know a scalp is tough.
Yeah.
We do have a lamp that's for scalp psoriasis.
Okay.
But yeah, it also works on vitiligo, alopecia areata,
Okay.
psoriasis also, but it's kind of specific to autoimmune.
Yeah.
So so there aren't any lamps. This lamp in your area. I was gonna say I could send you somewhere.
Yeah.
But the closest one is Philly.
Okay.
Yeah.
I hate driving to
I
Philly.
I'm from there.
Yeah.
So I know.
Yeah.
I like driving this direction.
But
rather than
not
that
yes.
direction. Yeah.
I'm the same way.
Right.
I would much rather go to Baltimore than Philly any day.
know. Yesterday I was in New Jersey, like right over the bridge in Philly, in Cherry Hill. And it's only about 20 miles from where I live. and it took me over an hour to get home.
Yeah.
And it took me, well, because the rain, it took a little longer today, but normally it would take me about an hour and 45 minutes, and this is 90 miles. Like, it's like, it's so stupid. So, yeah, I agree with you. But anyway, so this is easy. For skin of color, the only thing, it's not in the book, the only thing that's like kind of important to remember is to cool the skin for skin of color. And actually, is the
posts.
We have a book for it somewhere.
So for skin of, do you treat much skin of color here? All right, good. So if you're using the Era on them, if I'm treating you two, I don't need to necessarily cool your skin. You might like it, and we can, but you don't have to. If you're treating skin and color, you do the whole cheek, then you're going to cool it with ice, an ice pack, and then you're going to move over here. You just want to get that heat out right away.
Got it.
So that's really important. And with skin and color, you're going to go to about a 0.6.
Okay.
And I don't think that's in the book. The book is kind of aggressive.
Yeah.
So, and if you ever forget, just text me.
I got you.
I'll get back to you. Like with us, we can go to a 1 or 1.2. But skin and color, you want to be a 0.6 or 0.8 if they're not, like maybe if they're a 5 or a 4.
Okay, I was going to say where, like starting where.
Yeah, but if they're
so 4
approaching a 6, I would do a 0.6.
Okay.
And also, obviously, you know, skin and color should never see this ever.
Right.
Ever, right? History of the world. Yes.
Yeah.
But you can, but that's the only other thing, like just make sure you keep them cool, and then you have a whole other ice pack for this side when you're doing the forehead, so just kind of keep them cool. And same thing to your earlier question, like, super occlusive, but make sure, like, get the heat out first.
Okay, yeah.
So.
I got you.
Yeah.
And explain a little bit more with the cooling with skin of color, like that's because
just
it just gets a little
they're
bit
so
more.
much more prone to hyperpigmentation.
Right.
And that's their biggest worry. They get a cut, they get an acne lesion, they're left with a reminder constantly with that hyperpigmentation. So
the
same thing with them.
Really
Yeah.
help with that.
And the girl I told you about, she was skin of color. So like we were so specific about her post treatment.
I wish people would listen to what the professionals say.
It's so frustrating. So it just makes me.
But at least
I've
you
been
gave them
there,
the
yeah.
knowledge. But you know, if they choose not to listen,
It's true, but at the
then you
same
feel
time,
guilty though. At the
Yeah,
same
because
time,
it
because
was
you
our
treated
device.
them.
And then, so anyway, so no masks. Seems obvious.
Yeah.
And just keep it occlusion for the minimum the first 3 days, and then like for me when I do it on myself, I'm a 3-dayer, and then like the 4th day I'll still like wear some Aquaphor, but I am wearing makeup on that 4th day, and even kind of the 3rd.
I got you.
Okay.
So in those first 3 days, like SPF, is that okay to wear?
It isn't actually, because it's really, you're going to be like ideally not even anywhere near the sun.
Got it. Okay.
So unlike the Neo, this you do want to stay out of the sun.
Okay.
So even though SPF is super important, I would still wait until you're totally at least healed those first 3 days.
Okay. That makes sense.
Yeah.
Okay.
I know, but that's a really good question, because I messed up in the very beginning when I first started. I treated like a Fitz 5, Pakistani descent, and I told her to wear SPF right away.
Okay.
And she was fine, but like I definitely should have been more
We live and we know.
knowledgeable about something super occlusive.
Okay. I got you.
Yeah.
Okay.
So, are we ready to do that one, or
I
can answer any other questions?
I think she should be done any minute with
Okay.
the Neo. So as soon as she's done, I'm gonna grab it and bring it in, and then I'll bring Bailey in too.
Yeah. Do you want me to show you this?
Yeah.
Is it-
Because I don't think, Sam, you haven't seen it.
Not at all.
I didn't think so.
This is brand new to me. So
I've used it, so I'm like a little more familiar.
Is that what you were training on the one time? With Carrie.
Here's the crazy thing with this device. Even though I have my goggles, I know you guys will have goggles. This device technically is not nearly as dangerous as the Neo is the dangerous one. Which you would think the opposite, But because this is not going as deep, like the Neo is so dangerous around the eyes. So
Because it goes so deep.
it goes so deep.
Okay.
It's so effective, but the eyes are so vulnerable. If not, you can be in the same room if somebody's using it, but I always worry about, God forbid, they start having a conversation and like they're shooting this gun at everyone. So this one nowhere near as dangerous.
Okay.
But you would totally think the opposite. So I personally don't even wear goggles, although I shouldn't say that out loud with this one. But you probably should wear goggles, but it's not as important.
Do you think we should grab some, or what do you think?
Nah, I'm fine.
Okay.
It's okay.
Oh, this is the wrong thing.
You can unplug that top plug too if you need to.
I actually won't even use the evac,
Okay.
which is what I just plugged in.
Okay.
So thank you.
Do you want me to take a video for you? Of you doing this?
You're
Your
doing it,
social.
baby.
Okay, but when you're doing it though.
You're
You're
doing it.
gonna do
I'm gonna do like maybe a pass on her.
Okay.
I'll let you see how I do it,
Okay.
and then just to make sure I do it
Okay.
correctly to Teresa's standards. But I want you to do her face.
Okay.
Yeah.
Alright, sounds good. Well, maybe if you don't mind, if you could do a video.
Yeah. I gotcha.
I'll grab glasses, so.
I'll get you glasses.
Yes. Thank you.
Yep.
Okay.
So it starts at 0.6. So again, really just our skin color patients. It will go to a 0.82. So again, still a darker fits. Doesn't have, so maybe like a 4 or a 5 you can put on a 0.8.
Okay.
A 6 fits a 0.6. And then for 1 through 3 you can go to a 1, or you can even go up to a 1.2.
Okay.
Right? Like for
So
some
1.2
reason-
is going to be the highest
Yes.
for someone 1 through 3.
Exactly.
Okay.
It's a little bit more downtime,
Thank you, I
but
appreciate
it's not. So yeah, it's a little bit more downtime, but if I'm your patient, I want you to use a 1.2.
Okay.
Yeah, especially because I'm older and I want a really good result. So
Okay.
and then that just means single pulse, just like the Neo, and then this will go up to it will go.
Can we jailbreak our Neo, please?
I know, right?
Once we hit, I think 7, it puts us down to. It makes it so
It
slow.
does make it slower, and that's like a built-in safety mechanism. I know.
I get it, but
I know it's annoying.
I know.
I'm with you. That's why, like for this one, you can go. Wow, yeah, it doesn't even let you go
I know.
up to.
That's what I say. Can we jailbreak?
I don't think so. But there's another, not the Era though, but there's another version of the Neo called the Neo Germ,
Okay.
and it doesn't have those restrictions.
Okay.
Also a lot more expensive. And the reason they even have that is because the derms wanted a different device than all the med spas. So we're charging them accordingly, and so they can say they have the Neo Germ, and it doesn't go down to a 1.5.
Okay.
But I hear everything you're saying. So yeah, this one's gonna make you go a little slower if you go higher, but jeez, I didn't realize it
Capped you off.
at like a 0.6.
Yeah.
Jeez. Well, here's what I'll say, at least with this device, is
You don't have to do as many. Like you don't have to do passes. You do one
Exactly.
pass and.
exactly.
Yeah.
And then sometimes if you're going too fast, it gets a little bit like whoa,
Yeah.
whoa. So, and this one you know exactly where you missed.
Okay.
With the Neo you don't.
Mhm.
Gotcha.
So I actually, this one, I know it gets the bad rap because it's ablative. It is so much easier. So like, you can literally see where I missed.
Yes.
So like, when you do the whole face and you go back and you hit those areas, or if you want to go back a second time and get like those first feet, you can go back on top of it again. So this one is, you can so customizable with this. I'm going to show you the difference between this lens and the 6. And again, like if you have somebody kind of like much older with a lot of wrinkles that's up for the downtime and that she knows that she's going to have, or he, you can use the 6 on the entire face. or you can do this twice on the entire face. If you're going to do an entire face super aggressive, this will save you time. But other than that, I would use that and then just go back on the bad areas with that one. So, and this one, let's see how far.
Thank you.
This one, this is collimated just like the Neo, so technically I could treat from all the way back here. And that's why the Neo is so dangerous, because I could be like talking and then somebody walks in and I'm like shooting it that way because I'm talking with my hands and they don't have goggles on. So this is, let's see here. I'm gonna have like marks. Oh, these are gonna be like healing over the weekend. People are gonna think I have like chicken pox or something. But you see the difference?
Yeah.
You can smell the difference. This just goes so much deeper. So anyway, I always turn this off. Oh, no, I was being impatient. I always turn this off before I change the lens too.
Do you know if anybody sees that in here? That one?
I don't know. I don't think so. Come in. Can I come
Hi.
in you? Are you done with it?
Yep, perfect timing.
I'm gonna just grab it and bring it in here.
Okay, how are you?
I'm good. How are you doing?
I'm
You look so
good.
pretty.
Oh, thank you.
Always.
Did we get a candidate from the era? A volunteer?
I need you guys to realize how amazing this machine is. We need to push
We do
more.
probably underutilize it, I'm not gonna lie. Yeah.
It really is.
But I'll tell you what, without a doubt, on our darker skin tone clients, even like PIH or even PIE on like a FITS 5 or something, I've seen miracles happen. My one client, she is a FITS 5, FITS 4 or 5, and we were getting her ready for her wedding, and she's been doing like microneedling sessions, right? So we went through a whole series of that. She has some scarring, but a lot of it was the little PIE that was left behind in the PIH.
And that helped.
And then I talked her into it, and she was very nervous because of heat in general. And we did it, and when I brought her back in we were topping it off with one more microneedling session. Her skin looked phenomenal, and she was so happy she did it.
I love that. That's great. I was telling Sam and Regan that this device can, you can really customize it too. So if somebody comes in and you want to use, I'm like preaching, I know, but this is the lens you always want to use, especially with darker skin type. Unless you have somebody with like super like wrinkles literally everywhere, or acne and scarring literally everywhere, and they're up for some big time downtime. This 2 pulses of the 10 is equal to 1 of these.
Oh, okay.
So you can just do the full face and then go back with the 10 and go over those crow's feet or the laugh lines, like the bad areas. So you don't need the whole face like that.
Gotcha.
So it will just allow you to customize it. And then with those darker skin types, you probably know this, but I was telling the girls that make sure you cool that face with ice packs. But
Take the heat out.
it's such an like this one's so easy versus that one, and that's easy. But this one, you know exactly where you are. You
It's
know
so much
exactly
more
where you mess.
streamlined. Yeah.
Yes. So
This has little nuanced things to it. Sorry. I just got Invisalign back in today, and they have these little nubs on the back, and it feels like 2 buck teeth back there. So I'm making a little Look. I'm sorry. This is
Oh,
really
you're gonna
gross.
take them out? Okay.
I don't really know. What are these nubs? They're like big.
Oh.
So when you
do
hear
you
me,
have like the little things on your teeth?
yeah, they just this
Yeah.
morning put them
I
back
had
on.
Invisalign like 15 years ago.
Yeah.
And I always felt the same way. Like I would not have known, and I had Invisalign that you had it.
Yeah.
So
Well, I mean, I didn't have those the first time. And a lot of people didn't the first time that I did it, which was a year ago. This is actually like the fine tuning at the end. They took the little nubs off. I got the permanent retainers. My teeth started shifting again, and I was like, "Can we pick back up where we left off?"
And
they're
that's
like,
so
"Yeah."
good.
Well, thank
Your teeth
you.
look great.
But yeah, she's right. That is way more streamlined. The only downside, in my opinion, to these lasers, because she knows I love them, is if it's a long treatment, it gets heavy.
Yeah.
That's it. And you gotta adjust your body, but also I always preach this, and she can attest to this. Move the client, right?
Yes.
Make them move to make you as comfortable as possible, because you're gonna deliver a better treatment for them.
Okay.
Yeah. Yep.
That's really good advice. Very, very good.
Don't be afraid to be like, can you turn your head side to this side and then that side. Don't be afraid to speak up because honestly it's for their benefit ultimately in addition to yours.
Okay.
Yeah.
Especially because with this, you have that too. You have to keep it perpendicular to the face.
Yeah.
So.
Okay.
Whenever
And
you like
that,
get to
because
the side,
if it's not, let's say, as soon as you angle this to be like that, this side over here is getting more energy put into it than this side over here where it's sitting up farther. So you still want to be perpendicular, and that's why when you're going around the curvature of the jawline and everything, you kind of got to work your way with it and keep it perpendicular to the skin. Especially like with melasma patients, I mean that's stuff you want to make sure you're getting the even, targeting it evenly.
Okay. Good to know.
Yeah.
Thank you.
Are we good to bring
Yeah,
the model back?
absolutely.
Okay.
This is exciting.
Yes. Okay, I'm gonna
So
slide
I'm
this
gonna do
one.
it.
Yes,
You're
I'm gonna
not
do a
doing
couple passes on
Okay.
her, so you can kind of see how I do it, and Theresa can make sure I'm doing it up to her standards.
I was like, I was just gonna watch, but
Oh no, we're throwing you in.
Oh, no, this is how we learn.
Yeah. So now you just show it.
I'm glad we had the time with this.
Yes, I actually really do like this. It's just I think the downtime that gets people the most with it. But I mean, if they're doing like microneedling, it's not much different.
You
Yeah.
do it on a Friday. By the time they go back to work on Monday, they're gonna look so much better than they will on Saturday.
Yeah.
The turnaround is pretty quick. As long as I was just telling Regan and Sam, as long as they keep that something inclusive on those first 3 days at least, even if it's Aquaphor or Vaseline, something doesn't have to be fancy,
Yeah.
but just occlusive like it's their job
Yeah.
constantly, they will heal pretty quickly. And then literally by day 3, they won't be all better, but they can kind of hide it with makeup. So
and that's for both of them, or
just the era.
just the era.
This one here, they can do whatever they
Put
want.
it on back for business.
Okay.
There's no downtime with this one.
Down. Get down.
Yep, lay down.
Lay down.
Hi
This
there.
is Bailey.
Hi,
Nice
how are
to
you?
meet you.
Hi, Bailey.
Hi.
Hi. Yeah, lay down. Lay
Have
down.
you ever had a laser treatment before?
No.
Well,
She's
this
like,
is
I got
the
clarification.
probably when you think of laser, you think of downtime, you think of pain. This is not that. You have 0 downtime today, and you'll feel a little bit when we go over your cheeks just because there's a little bit more red there, and that's normal. And as we build the heat into your face, you'll feel a little spicy, but again, nothing you can't tolerate, and that's just the collagen building, which is a good thing. So we're gonna heat your skin like one section at a time. So what that's doing is it's looking for targets. So it's looking for I'm making you look up.
No, you're
It's
fine.
looking for targets. So target can be hemoglobin, which is our reds. It's looking for brown. So if you happen to have like upper lip hair or anything, we're gonna get it while we're here. And if you do, you'll feel it, but nothing you can't tolerate. And then also we all have water in our skin, and that's where we get that tightening because we're superheating it. And we're building collagen because the collagen is like, wait, what's going on? There's like injury. So it races to the surface of your skin. So today when you leave, you'll be a little pink, but that will subside and you'll just be glowing.
I'm normally pink anyway.
So and actually you'll be like more evened out. And then tonight, and just not tonight, but in a couple of hours, your skin's gonna be like less inflamed than it is now and glowing. So yeah. And it's like a slow and steady wins the race. So over time, over like every 3 to 4 weeks, a treatment of this, like an airless treatment will slowly work on the reds in your skin and kind of your body will absorb those. That's how that works. So,
Energy 7 for her. And this is gonna cap us off. Yeah. She said we can't jailbreak it.
Yours
I know.
is, isn't it?
I was telling them we have the Neoderm, and that's what I know because I know when I get another one, because they swap ours out, I know they're going to give me a regular Neo because I got that by accident.
Did
I didn't want anyone to know I had it.
I don't blame you.
Yeah. And
That thing was heavy. She let us borrow hers when ours needed service. So I had the luxury of experiencing like the 2.0 speed
I know.
while we're in like energy mode 7 and 8. And I'm like, oh my god.
I
Yeah,
know.
it's like a luxury.
And I know I'm waiting for the phone call. I'm gonna cry. I'm literally
No.
gonna cry.
No.
So I'm
Gatekeep that for as long as you can.
Mhm.
Yeah.
No, they know now. Because I have had
Oh,
to
do
share
they?
it at events and stuff. But, so they do know.
Wait,
But I
because
don't
of
think I'll get another one because I know I got it by
Mm.
accident. So, like, there's other reps in the company that have way more tenure than I do that don't have one.
Oh.
Yeah. And they were like annoyed when I got the
You're like, I'm special. That's all.
So, yes.
Now with this, we want to wipe the skin with alcohol first, right? Okay.
Yeah. Even like just moisturizer, this device will see that as dirt and we can like leave little marks. Nothing that would last for a long time, but you don't want any of that when you're treating your clients. You don't want any phone calls but good phone calls.
Yeah, if you have anything on top of the skin, it's going to target anything that's sitting on it and versus what we're trying to target down in the skin.
Okay.
So any little, if you, when in doubt, have them wash their face first and then still alcohol them afterwards, just for good measure.
Just make sure.
Mm-hmm.
We did just
Put
more
some
and more
more
alcohol,
alcohol.
just so you guys know.
Oh, nice.
Has this been on for a while, the service button?
Since we got it back, I just figured it was.
Since you got it back?
Mhm.
From where? Service?
Mm-hmm.
And
When? How long ago was that?
the button never
Like a
went
year ago?
off?
Mm-mm. I wanted to ask you. That's part of the reason I wanted to pop in. I wanted to ask you why.
Yeah, it is always on.
So, what that probably means, actually, I want to see something. I want to see how many pulses you have. Let me just, you know, when I turn it off,
I know.
when
I
turn it
forget.
off again, I'll turn it on to see how many pulses you have on there. You probably have over 1 million.
I wouldn't doubt it. This thing is a
Yeah.
workhorse here.
But I'm still going to take a picture. If you have over 1 million, this is just telling you that you need a PM. But the
Yeah.
fact that it was on there when you got home, I mean, when you got it back, is kind of annoying.
I just figured it meant good to go. You just had service.
Yeah.
And I feel like when we got it back, it was just like hit the ground running again. So
Well, we use it constantly.
yeah, we do.
Alright. You know what? I'm going to look up how to do it.
I know. I forget how to do it too.
I always forget.
You're in. I think it's in there somewhere. Try hitting pulse width again. Or not.
Definitely don't leave it
I'll try looking it up.
there. Alright, I'll find out. Let me just-
We have more glasses.
Yeah. Do you want some?
These? Yeah. Oh, here, I got it. Good. Now, if you turn your head, I'm going to start on your cheek down here. Okay, you ready? Am I?
You're good. And with this collimated lens, it really technically doesn't matter how far close you are. So just like as long as you can see what you're doing.
Okay.
Obviously, you don't want to be too far because then you lose control.
Mm-hmm.
But yep, and then you're just going to do a snake-like pattern.
Okay, there we go.
And I would say like think of the Olympic rings. So you kind of want to overlap, even though you can't necessarily see where you are or where you just went.
How much overlap? Sorry, I was
That's fair. About 10%. So you just kind of about 10%. You just want the pulses to touch each other. So sometimes it's tempting to, and you're doing a great job right in. Sometimes it's tempting to go too fast and then you miss like big chunks of skin. So you want to definitely have to be very nice and patient, and her lines, not only are the pulses touching, but her lines are touching. And that's what you want. Very tight lines.
okay. Can you hear me?
What?
Is it spicy?
Yeah, it's not that bad. I thought it was gonna be like that one thing, where I had on the blood vessels that like hurt. What'd you do? I don't know. Something I had done before for like the rosacea and the lines that like hurt.
Oh. IPL? No, you wouldn't have had IPL.
I mean, at least
There was like a little pen.
the mother and maid.
Lift your head.
There you go.
Sorry.
Back
This
here.
side? Yep, right here.
I was scared. Something in there.
This can help with me so much.
That's perfect, Megan.
Yay, thank you.
Changing directions. You're not missing any skin.
Yeah, so Sam, you're going to do like a cross-hatching effect every time that you do a pass. So it'll be like up and down, and then you go side to side.
Okay.
Up and down.
With 10% overlap.
And then I kind of just, and I play like a game of Snake, old school game. I don't know, am I too old?
No, I know what you're talking about. Okay.
So I'm kind of just up, down, and of course everybody's face shape is different, so there's little nuances to everybody's face, but generally up, down, side to side.
Okay.
Depending on what you're treating, what do you think, Theresa? Anywhere like Neo Clear, which is for the acne protocol, 3 to 4 passes is probably sufficient.
Okay.
I think that's what's in the book too.
Mm-hmm.
For redness, this is her first treatment, so you could do, I would prefer to do 6 passes regardless, and if it's feeling spicy, go down to like energy mode 5 or something. You know what I mean? Like just bump it down a little bit. But I think the more passes that you can do, the more heat you're going to build up, the better result that they're going to get.
Okay.
Yeah.
Okay. So 6.
Yes, absolutely. The only protocol that's a little bit different, only because you'll start to notice a lot of the protocols repeat themselves. So the rosacea is very similar to skin rejuvenation, except for it's a little bit higher in fluence, higher level. But for the most part, they're almost the identical protocol. What's not in the book is melasma. I wouldn't bulk heat each section. I would just do the whole face, like whatever 4 times or however many times they can tolerate, because you just don't want to bulk heat that. So even though we want to give them a nice skin rejuvenation, their bigger problem is melasma, so we want to get that under control. But really, every other condition out there, you're going to bulk heat like we're doing right now. So 1 section at a time.
Okay.
And that's not in the book, but that melasma. But
That's good to know.
yeah, it's
Sometimes I'll just reduce the rep rate so that they have a little bit longer of a cool down period. It'll take longer to do the treatment, but it's going to give them a better outcome too.
Okay.
So cool down in between with melasma, is key, regardless of what laser you're doing, whether it's resurfacing or this.
Because heat can really bring it on.
Yeah, so Era can help with melasma, but as soon as you're done with that treatment, or even like done with the first peak, get an ice roller in their hand and let them start to roll it. Because the sooner you get that heat out of the skin, the better for them.
Okay.
Yeah. And I think what makes this unique, so technically this is a 1064 NDI laser. 1064 is the ideal wavelength for hemoglobin, redness in the skin. When you get into browns and targeting browns, you're more in like that 755, maybe a 532 wavelength. But the unique thing about this is when it treats melasma, melasma has, oh my god, guys, I'm sorry. It has a vascular component to it. So you are targeting hemoglobin in addition to melanin whenever you're targeting melasma. So that's why this has been a game changer for our melasma clients. And I mean, the key to set expectations, it is a slow and steady wins the race, but it's like, here's your trade-off. You can either have downtime or you can come in and you pick this laser every 3 to 4 weeks have 0 downtime, you're gonna get more permanent results because this goes deeper than IPL, right?
Okay.
That's more superficial,
Right.
and you're gonna have longer lasting results.
Okay.
Yeah.
Price point for that. What is it? I'm not even sure.
$350 per session, to encourage people to commit to a series because that's where this is gonna shine. We do buy 4, get 2 for free.
Okay.
All protocols. So, it's $1,400 for reds and browns, whether it's hyperpigmentation or melasma. If you're doing skin rejuvenation, that one's $1,800 or $450 a session. And then Neo Clear is $300 a session or $1,200 for a package.
Okay.
Neo Clear, you're also going to bring them back every 1 to 2 weeks?
Yes.
Yeah. So a lot more consistent because we're trying to kill bacteria in that one. Yeah.
So there's Neo and then Neo Clear. Okay.
It's kind of just a branded name
Yeah.
for the actual treatment.
Yeah.
Okay.
And it's very confusing.
Yeah.
I've been asked that many times.
Yeah, this is
Yes.
all very new to me.
Yes.
So.
You're not, the questions are very legit.
Yeah.
Okay.
Yes.
And truly the only difference is the number of passes. And then when you get more skilled into learning the basics here, then I can show you how to start to spot treat after a full face treatment. Okay, we can kind of push the boundaries a little bit, especially with somebody who's been through, let's say we're like midway or a little over midway through their series. They're tolerating it extremely well. We want to amp up the results now. We can make little changes to the settings, and even just changing out the lens but keeping the same settings on the screen will make a huge difference. So Theresa can talk to you about that then too with the lenses. But it's really, I love this laser. I can't say enough good things about it.
Yeah, I would say, and before I leave, I'll get my list of indications so they know really how many indications this treats. Are you guys even, are you interested in female rejuvenation at all here?
How do you feel? Nice and hot?
It is,
I mean, hot.
Is it?
yeah,
That's
so,
a good nerve
for
That's it. I think I just
vulva
mixed them up.
dystrophies, which
okay.
include lichen
Just
sclerosis,
Uh-huh.
I didn't know what that was. I
Okay,
just
then have you
looked up,
turn.
it's just like
Alright, so I'm
basically,
gonna
if
do
you
this
don't know
side
what it
first.
is.
Okay,
It's like, actually like scaling skin, it's very
Oh.
itchy
So
and
six.
irritated
Yeah, I did
down
6
there, in the
passes on
vulva
this
area.
side. She can tolerate it.
it's-
She's okay.
It's
And
kind
then-
of
So when you go-
debilitating
That's
condition.
one.
No,
It-
so
You know, it hurts
One.
marriages, it's
Two.
painful. So
Three.
this,
Okay.
yeah.
we have a brand new protocol that treats
And
it,
sometimes
it's
I rush back.
90% clearance.
Wow.
None
What's
of
that
the
happening if
hormonal.
you're not concentrating?
So
would
if,
have
and
to
then
have a
of course you get some
conversation while this is
rejuvenation as
going.
Luckily,
well, if you
most
think
people don't
about like the
tolerate
science
it.
behind
It's
it.
so loud.
Obviously hair removal too,
Really
so
hard.
it is
That's something I will
a
definitely
whole
like,
new
I'm not gonna
side
do
of
this
our
anytime.
practice that we're
Yeah,
kind of
that's really
building
cool.
the female rejuvenation, so if you guys are ever interested, I can send you the protocol, you already
Okay.
have the device.
Yeah.
So,
Why not?
yeah, and more and more med spas are getting into vaginal rejuvenation,
Yep.
so, that and HS, do you ever see
Do you want me to
HS
turn this
clients,
down
and that's like
on it
those
so it's not going so fast?
awful,
Or
just
do you want to try it at the
welts
Let's
underneath
try
the
it, and
arms,
then
like
I
where
won't
hair
too
is,
fast.
and also the
Yes.
groin
Yeah,
area.
we do have a client that has them down there in the groin. Yep.
So we, that would just really be the hair removal protocol,
Okay.
and it really works, and also
That's good to know.
gets those clients off of some of those biologics that they're on, and it's, again, it's holistic, we can really help these patients.
Cool. I'll grab. Wait, I can go my phone. I gotta show you this. So my husband, he got, I don't even know, like 3 huge cystic zits right here, and he never really had that before. It was very random. It was probably about like 2 months ago or so. I was looking, and I'm like,
Thank you.
they look extremely inflamed. They were,
And
they
then this
looked
is
like
how
a
you
golf
stand
ball.
by
It
it.
was
So
crazy.
it's just
And then as they were
in it
healing,
and ready
you
it
could
the
see
whole
it
time.
almost looked
So
like
whenever
little like
you're ready,
open
you'll just
wounds
step
where
on
the
the pedal and you'll
probably
keep your
pus was
foot on
gonna
the pedal.
escape, right?
Uh-huh.
Okay.
So I told him, I was
So
like,
you'll
Oh my
start.
gosh, I'm sorry.
no, you're fine. I was like, just come in, let me shoot it with the Neo.
So I always
gotta
like
show
to
you.
start on this side, and I
Who's-
normally go down. I go like
The
this.
next day, like less than 24
Away,
hours.
and whenever you start to kind of go around the
They looked
curves is
so
when you
good.
want to more keep track that you're not missing an area or overlapping too much.
Okay.
Yeah. So I always start on this side and I just work my way in.
Okay. Yeah. And then stay away from obviously too much in the hairline.
Yeah, I mean you can hit her side brush. I don't think she'll mind. Alright.
So
The only other thing I didn't mention, try to keep your hand off
I
of the
know.
filter, which you're doing a good job. I just didn't want
did
to
see
not
that
tell
in,
you.
like, the demos online.
And then the filter is.
I'm really trying to get through those old filters. I really don't like them.
Aren't they?
We have new ones, but we're trying to get through these guys.
Yeah. I think that one went back to. Oh my goodness.
I know. I'm like, what is going on with your head? They brought him in.
She'll turn. There we go.
That my little boy.
Oh my
You know, look. He busted his face up.
Oh my goodness, baby. What happened?
Oh my gosh, he fell off his scooter. That was the next morning.
Oh my gosh.
Look how all the inflammation is gone.
That's amazing.
And it started to scab over already.
Wow.
And I was like, okay, I freaking loved it. I mean, I already loved it, but it went from that.
What happened? Yeah, look at all the inflammation underneath it.
From that to that.
Oh my god.
What's
That's
this?
great. And were you able to avoid any kind of scarring or
like,
Oh,
yeah,
yeah.
like the steamer.
Amazing.
Yep.
That's amazing.
Teresa, what
I
does
also-
this mean?
Okay, so when you get this, you can ignore it just by pressing this.
Okay.
And it's just a reminder to change your filter. You don't have to.
Okay.
It doesn't know if you did or didn't. So every 6,000 pulses, you could change it right now.
Got
Or
it.
no, you could have changed it a minute ago, and
it's still-
it would have still done that. So every 6,000 pulses, so you just press the stick.
Okay. Alright. Then you're good. Alright.
So that is amazing.
I know.
I love that.
I need to do like a little before and after because I want to post that on my Instagram to
That-
show people. I mean, I tell people, I'm like, I actually just started. I got clearance from a PCP to do a little girl's toenail, the fake toenail fungus.
Right.
So we did one
Yeah,
treatment
just
so
for
far.
training.
She's coming back in a couple of
Well,
weeks,
oh,
I
I'm
think.
sorry, I meant
So
on
I'm
your,
hopeful.
your
Yeah.
phone or my phone.
And she, you really
you're saying
only
you're already
need one
doing
more
it?
treatment, and then she just
Oh.
needs to grow it
Stand
out.
behind you,
okay.
right?
Yeah,
Oh,
so
geez.
just tell her and her mom and dad, whatever, they're just gonna have to be a little bit patient, but in about 9 to 10 months, it will grow out
Okay.
really nice.
Let's
And
get
then
that.
obviously treat all 5 tears. And toenail fungus can be painful, but she already had treatments and she knows.
Okay.
I mean, she's tried like over the counter and stuff. I think they even put her on some antibiotics before for it, and like nothing worked. So she's like, her mom, well, she's coming to me for the face, and then I'm hyping this thing up about everything that it treats, and she's like, oh my gosh, my daughter has toenail fungus, and it's just on her little middle toe, and nothing is helping it. I said, if you get a note from PCP clearing her for me to use this on her, I will give it a go.
Right
I
back to
love
regular
that.
and
Yep.
start working
Yep.
this
So-
way now.
Yeah, you're gonna get it.
Yay.
That is exciting. And you know what? Since you have the evac, the airvac, you can even use that in the same room. Same with warts. If you do warts,
Yeah.
might as well get those spores out of the area.
Yeah, that's true.
Do you want me to slow it down for you?
Actually, I need to.
A little bit, yeah.
I'm gonna let you guys continue.
Go ahead and stop.
I need to order buffalo filters. That just reminds me. Alright, have
Go
fun,
ahead and
girls.
try that.
Thank you.
It's gonna go a little slower now.
Yeah.
Yeah, and that's what your Sam. I should have told you that. Getting started, go a little bit slower.
Okay.
To get the technique down.
Right. Get used to like holding it and everything. Well, she did say, and I was like, oh, I'll just give it a try. My did say she could hold it down.
How are you feeling?
Good. She's a trooper. I've put her through a lot with her face over the years.
It's nice to be a guinea pig though in a way, right? Hopefully in some ways.
Sometimes.
My sister loves it, except for when she was my guinea pig for Brazilian waxes like 11 years ago.
Well, I kind of trust her if she tells me it's a good idea, it's a good idea. If it's a bad idea, it's a bad idea.
Yeah. So you're getting a little, like, what if you get a little more straight, especially when you're over here. It's a hose pulling too much. Is that better?
That's good right there.
Okay.
So if you, and I'll say, if you want to see a donut, not an oval, and that, if you see an oval, that means you're not exactly perpendicular.
Okay. Okay.
But you're doing really well.
Donut,
Yes.
not a little.
If you pull it up a little bit, like you can see a little bit better, But really, everyone has their own way, so there's no right or wrong as long as you feel comfortable.
So you can go as far as
Yeah.
here?
Mm-hmm.
Really? Okay.
You can go across the room, technically.
You did say that.
Yeah.
I wasn't sure like how.
Yeah, I mean, you wouldn't, but you
Right,
could,
right.
because this particular lens is a column, and it's just going to keep going until it hits something. That's why it's dangerous. So, like, if you're like talking and you hit Reagan's shirt, you're going to put a hole in it. You hit the wall, nothing happens because it's looking for pigment. It's
Right.
looking for a target. So white all day long, you can hit that wall. You hit your shirt or my shirt, big hole.
Yeah.
You know,
Oh my.
like
Now,
people get a
I have a
strike.
question. If we hit our gloves, obviously our gloves are black, but is that gonna then go like hit us and hurt us?
Well, it's gonna burn your blood.
Okay.
Yeah.
Okay, but it's not gonna necessarily hurt us.
No.
Okay.
No, it's not gonna hurt you, but
Okay.
it's gonna burn your blood.
Okay.
So maybe the gloves might.
I didn't know if it would like maybe melt onto us.
Maybe. I don't know of any situation that's happened.
Okay.
But I do know of situations that people like step on the pedal, like when they weren't quite ready, and they shoot across the room and put a stripe in someone's hair. So I mean, it's better than the eyes,
Yeah.
but it's definitely a loaded weapon.
Yeah, we are, like all of our lasers, because all of our beds are darker colored, so we always make sure like don't ever point it at our bed or
Right.
we're blowing a hole through it.
Yeah, you are.
Yeah.
Absolutely.
And Holly would not be happy if we did that.
No, she would not.
No.
Anytime. Find how to check the pulse count. I should know this.
That's
I used to
pretty
know
good.
this.
Okay.
It gets heavy.
It does. Need to go back to the gym. See how that can get tricky with keeping it perpendicular to those
Yeah.
areas. For sure.
Well, especially like because the hose does kind of pull it to an angle whenever you get to a certain area. And that side of the face, I always find it's a little trickier because you are coming across the whole side.
Right.
Yeah. Yeah. Now, with someone like her, like how her cheeks are, after we do the full 6 passes with the 6mm lens, can we then go back with another lens and kind of spot treat over that? Or do we
Yeah.
not want to since we did the 6 passes?
Not so much over her rosacea, but
Okay.
if she had something else going on,
Okay.
let's say she had some sprainer veins
Yeah.
or some acne,
Yeah.
then that you would spot treat.
Okay, that's kind of what, because she does have like a little bit of veins throughout, so I'd love to just
Yeah,
hit those.
they're fun too.
Okay,
Yeah,
they are
so
so fun.
we can do that. Once we're done this, we will go and we'll change the lens. We'll go with the veins, we'll change the lens. Because she's a fixed 1 through 3, we can use the 2mm.
Okay,
And we'll go ahead and trace some of those veins.
perfect. And then we keep the same settings.
No, for
No.
the veins we'll change it.
Okay.
And veins, obviously there's leg veins and face veins. You treat it very differently because leg veins are going to be way more aggressive. So here, that's why I have like this.
Okay, I got it.
So for leg veins, you could. Sorry, I don't know why I keep getting those on.
It's okay.
Okay, 1-5.
Alright, feel good. She doesn't listen to me.
I don't think she can hear.
She can, she has selective hearing.
Is that true?
See, I told you.
I don't think she actually hears us.
She definitely does.
Well, actually,
I told you. She just ignores people. So
just want to make sure you're overlapping yourself in front of it. I know it's hard because you
I
can't
know,
tell.
and it's hard to tell.
Normally, if she was just coming in for face creams, we would do the warm-up classes here. But since we're doing more of an aggressive warm-up, because we're doing pretty much a rosacea / skin rejuvenation, I would go lower on this node here, and then we're just going to trace the veins. The most important thing about veins is you don't double pulse. I know sometimes it's tempting, you're going to feel like, get it,
Yeah.
but just don't. And then really you won't know. Sometimes they disappear in front of your eyes. Sometimes they'll turn gray, sometimes they'll turn purple. But you really won't know unless they disappear in front of your eyes if they need another treatment for about 2 weeks. So as long as you set those expectations. Sometimes patients will blister. And it's not because you did a bad job, they blister.
Okay.
Yeah.
When
will
can
be
you
okay.
blister? When can a client get blistered? When you do the veins, when we just target veins.
So obviously we don't want them to blister, so we want to try to avoid that, so that's why you don't double pulse on a vein, because we're going to trace it. But if they call you the next day and tell you they blister, it's such a panicky phone call for you and for them.
Yeah.
Let them know that it will be okay, and they won't know for about 2 weeks if we have to hit it again. Okay? So you might even want to tell them that before they leave. It might blister. Just ice it if it does, and make sure, just like the era, occlusion.
Okay.
Okay? After you blister.
Do you want to do like 4 passes in the mouth area? Sorry, right in here. And then you can do 4 up on her forehead too.
So 6 in the more vascular areas.
Yeah.
And then less on the
Typically, yeah, for like the thinner areas, so like this part of the face, I like to do 4.
Okay.
Yeah.
That's a good long term, for sure.
Just because it is thinner and it heats up so much quicker on them. Sorry.
Foreheads are pretty sensitive too. Foreheads don't have as much target,
Yeah.
but they're obviously thin.
Yeah. And then I guess same with neck. You would want to do probably lower passes.
No.
Or since it's such a big area, it spreads it out so much
Yeah.
better.
Hey, you do want to like cut the neck, ideally in 4s, but at least in 2s.
Okay.
To both feet.
I gotcha.
And if somebody is doing skin rejuvenation, are you guys including the necks? Is that part of the package?
So they can add it on if they want to. Yeah.
I would definitely try to encourage them to.
We always do, and
Right.
typically people do it
Yeah.
just because why do you want your face to look 20 years younger than your neck?
Exactly.
Yeah.
Exactly.
How are you feeling?
I can see how this appointment takes a little bit longer.
It feels so much more different down here than on my cheeks.
Does it?
In what way? Like more sensitive?
No, not even close. This cheek was worse, closer to the nose than the other side.
Yeah, that cheek gets worse though, doesn't it? One side of your face does.
The second side tends to get more heat than the first. And I don't know if it's because the heat travels. So we hear that a lot, that the second side is a little bit spicier than the first side. And also you have more target in your cheeks than you do your middle of your face, so that's also why you felt it more.
this, we can do whatever. So we can put like the Phyto gel on her to
Yes.
help with the redness still too. Okay.
Yep, you don't have to worry about trapping heat or
Yeah.
anything like that.
I didn't think so.
Yeah, you can go to town, whatever you want to do.
Okay.
This is relaxing though.
Dare I say, right?
Yeah.
I mean-
Especially on a cold day.
Yeah.
I know.
And to think about it, how often as women do we get treated on? Especially something like this, if they're coming in once a month, they're actually looking forward to it.
Yeah.
It's not like the facial that they get once or twice a year, that they like, treating themselves. Not even with Botox, even though I personally think Botox hurts.
I hate getting
I
Botox.
hate it too, but it's necessary evil. But that's like what, every 3 to 4 months or however long. This is once a month, you get the treatment, you get pampered, you leave glowy,
Yep.
you see the results, and eventually, here's what's going to happen. Like in about 4 months, when you've had your 4th treatment, that's when your friends are going to start saying to you, what are you doing differently? You look amazing. That's when, because not only are we addressing the hemoglobin in your cheeks, we're building collagen. We're giving you a full skin rejuvenation. We're addressing any little itty bitty imperfection that we all have.
Do you think I'm going too close?
No. I think as long as you can see, you're fine, and I think your rows are absolutely perfect. You can even do lip rejuvenation with
I
that.
know Jen does a lot of the lips. I want to do some lips. Yeah.
They can have blushing, but as long as their lips are perfectly clean, you can do lips. And
It makes a difference.
it does. And it's a small little upcharge.
Yeah.
If you're doing skin rejuvenation, throw in the lips.
Yeah.
So tell me, like, what does it normally look like after one?
I'll show
They'll
you a
just
picture.
be
We
a
can
little
look
bit
through
like
ones too.
They'll just be a little bit more volume. I'm not the best example because I don't have great lips, but I do to myself
Nice
once in a while. Thank you. But for me, they look good.
Yeah.
I don't have good lips.
Yep.
So, but for like real regular people, that's not the best like advertisement. But for me, if you saw like my lips before, but yeah. I love the Revive posts. Instagram posts are just some of my favorite ones.
The funny ones or just the serious?
Oh, I like the funny ones.
I like the funny ones too.
Funny ones are so cute and clever. Who does them, Sam? Is that do you have this carry behind those?
Honestly, we all really just do it together.
I love it.
We
And now that
find
I know
like,
you two, I'll be able to like recognize you and know you too.
we find a lot of the inspo like from other pages and we just try to recreate it to
I
make
love
it
it.
more med spa type.
So cute.
Especially down at the York office. We have fun down there.
Oh, good. So you go both offices?
Yeah.
I just stopped by that office about 3 weeks ago.
Okay.
I forget, it was a Monday, so it was
I probably was there.
Were you?
Yeah.
I just stopped in, I saw, who's the fact that office on just one here?
Laura.
Laura.
Yeah.
I saw her and just introduced myself, because I haven't really been there,
Yeah.
so I just wanted that office to know who I was, so I didn't know how to question anything.
I love it down there. We don't have one of these down there.
I know, you need one.
I'll be there on a Saturday next month.
Okay.
Yep.
How far is that from this office?
Oh, like 35 minutes.
Okay.
Yeah.
I'm excited to see, you know, like, sure, everything's pretty much the same. It's just a different building, different vibe.
I like it down there.
Yeah. Excited to check it out.
Yeah, it's a good spot. Plenty of parking.
Yeah.
It's here too. Parking's everything.
I know, I used to have a salon on Main Street in Mechanicsburg and it was all street parking.
Oh god, that's yeah.
It was not fun.
I think that deters people from going somewhere.
You okay?
Mm-hmm.
A little more sensitive?
A little bit.
Okay.
It's okay.
You sure?
Yeah, I have a lot of kids, so
Okay. How many kids you have?
I have 4, so
Oh, yeah.
I never know what's gonna happen.
I used to live on Main Street, Reagan. I don't know if I told you that.
Yeah, you did.
I don't miss it.
No, I don't miss being on it.
I don't miss parking.
Where'd you live?
28 East Main Street.
Okay. I know exactly where that is.
You know which one it is?
Yep.
Yeah, it was a little 1 bedroom. Yeah, I think that's when I saw you, honestly, when I was walking with Archie when I was
Yeah.
living there. Yeah.
I think so too. So you lived there with both your girls.
Yeah, we were all sharing a 1 bedroom at one point, the 3 of us. That was wild.
Yeah.
So, so glad I'm not there anymore.
Yeah. Very fair.
But they miss it. They're like, I miss being in the same room.
Oh.
That's adorable.
They're little, so
How old are they now?
4 and 6.
Still little.
Funny ages though.
Yeah?
No.
No, you're a baby.
Her kids are my kids.
Did you all know each other before here?
So that's my cousin that is laying down.
Oh, so you're saying your
Her,
cousin's
yes,
cousin.
her kids are my kids.
Got it.
But I met Sam, what was that, like last year, 2 years ago?
Yeah, something like that.
I was working at an event and I met her there. I loved her dog.
Oh.
Yeah.
So when I started working here, I'm like, we met before, but you were like, Sam, you did my lashes
I
over
think
at
you
Expressions. Which I have no memory of. That was so long ago. That must have
I
been
would
like
have
10 years ago.
Yeah, I would have been young.
So you might have been like, what, 15?
Probably. That's around when I started getting them.
Wow.
I don't feel them anymore.
Doing alright? Okay. I see your forehead moving, so nice.
It's just because she needs Botox.
I do so bad. Do you want me to push it off?
Can we answer her?
Who is it?
Your mom.
Oh, no.
Okay.
Probably wants to know about trick or treat.
Oh.
I feel like a lot of places were canceled today.
Yeah.
Trick or treat is on.
Oh, is it? Are we going?
Yeah. Yeah, Mason and I spent $100 on costumes last night. He's Batman and I'm Catwoman.
Oh,
That's fun.
Yeah.
I'll be a pilgrim.
Alright. Carter's Captain Underpants.
Who knows?
That's what he told me he was.
Layla at List wanted to be Wednesday.
That her oldest daughter is going to be Wednesday.
Yeah.
Is that her again?
Yeah.
Oh, you might want to answer.
Oh, I just declined her. Hold on.
Okay. Should I go ahead and do the nose?
Yeah.
4 on the nose.
And actually, you did amazing. To kind of like streamline it, next time you can kind of do this whole area all at the same time.
Oh,
But
okay.
that's
So
okay.
like,
You can kind of like
like
even a
that.
body rejuvenation. So yeah.
yeah. Okay. Good to know. Alright, here we go. We're gonna go work on the nose.
Now with the nose, like the goggle piece is obviously in the way and we want to keep the goggles on them
Right.
the entire time. What do we do about that?
It's clear,
So we can kind of hit it. That's what I thought. Okay.
Really?
Yeah. If you don't want to hang out there, but
Yeah.
you're certainly not going to
Melt
There's not going to
it?
be sparks or anything like that.
Okay. See, I was always curious about that because I try to work around it
Yeah.
as much as I can and like adjust it, but okay.
Yeah, you're okay.
Okay.
Now this isn't gonna do anything obviously with like blackheads.
It just
Or a
felt
little
worse.
bit.
It
Will it help with the blackheads too? Okay.
Absolutely.
Okay. I think it's gonna help with acne.
It does it all at the same time. That's the beautiful thing. So even if she's in here more in her rosacea, but whatever other like little things she has going on, we're gonna
Right.
address them all at the same time.
Now, what time do the kids need picked up
Right.
tonight from school?
3:40. 5.
Your mom says she's panicking. So we might have to just pick her out of here.
Okay.
Where is she?
Driving through Mechanicsburg,
What time is it?
3:23.
Oh, she'll be fine.
Okay.
Okay.
You all done? You look good. Look good? Okay. Alright. Okay. And then, do you want to change the lens on here? And then we can put the 2 on?
Oh, okay. I need to put my gloves on.
Oh, you can take it off, it's okay.
I love your chrome nails.
Thank you. It's so funny. I actually went with another picture. They're supposed to be like a darker copper. Like under here is chocolate brown. I went chocolate brown chrome.
Okay.
And then she put the first chrome on and I was like, that's not what but I felt bad.
Oh, yeah.
So I'm like, she's like, do you like it? I'm like, uh-huh.
Yeah,
I
I
know.
know.
But I do like them now.
You were
I do-
more like looking for the brown.
I just was looking for fall, but they're growing on me and it's fine. Just not what I asked for. So like I had to like readjust my brain. First world problems.
I get it. I get it.
Okay.
Okay. Alright, so let me put this on.
And then do you care if I hit some of her veins?
Of course, you. That's
This is
It's
all you
fine.
really. I just want you to kind of feel it,
okay.
putting them on and taking them off.
So Sam,
That's good.
you may
You
not
don't
have
want
heard
to do
because
too
you
tight.
were doing the treatment, but normally if somebody comes in for veins,
Mm-hmm.
you're gonna kind of do what you just did. You're gonna warm up the area, but you're
Okay.
only gonna do about 3 passes. But since we did a full skin rejuvenation / rosacea treatment, we did more than 3. So she's got a lot of heat in her skin right now. So
Right.
normally you would do like the warm up pass would be 3.
Okay.
We did like twice that, which is fine.
Right.
So we're gonna not go as aggressive that this says we can. So she's at skin 1 through 3. We did change to a 2 millimeter. You can go from a 6 to 8, but I think we should be at a 6 today just to be on the safe side.
Okay.
Especially since veins can be tricky.
Okay.
They're fun, but they can be tricky. So again, that's basically what you're doing now. For veins, I personally think we should either do single pulse so you can really take your time and move,
Okay.
or just go very slowly and like you don't have to keep lifting your foot, but you know you have time to move. Like
Okay.
that's what these middle ones are for.
Okay.
So it's up to you. You can start with single pulse and get a feel for it.
Okay.
But we'll find her veins. You guys have better eyes than I do. We'll find her little veins and then we'll just go ahead and trace them and so and then we can go up to a 6.
You're so little. There's one right here.
So do that guy and that little one.
You should take a picture too, because they're so rewarding when they go away.
I know we didn't get it before pictured, did we, with her?
No, I have plenty of
Oh, you
pictures
do?
of her face.
Oh,
so-
good. Prior. I'm so scared that this is gonna fall. I'm not used to working with this light.
Mm.
Okay, so do that little guy right there. Okay, so you said it's 6, single pulse. So every time I hit it, it's gonna, okay.
Exactly.
Alright. And we're not going to, thank you.
Overlap.
Overlap, we're not overlapping.
Exactly.
Okay. Alright.
And it gets very addicting. FYI.
Does it?
Yeah, you're gonna like be like looking for more just because it's fun. Especially when they disappear.
So it's going to disappear, like,
Sometimes.
Oh.
You really never know. And you want to touch the skin with
you
this
do
one.
want to touch
Yeah.
the skin, okay.
Dale, this is gonna be spicy on you.
Are you ready?
You right?
Yeah.
It's scary. Like when
I
you see
didn't
the
know what to
flash,
expect.
Yeah. No, you're fine.
Okay. Wow. Can I do a couple more? Or is
Did you get the whole vein? Again, I can't see as well as you guys.
So-
I'm 100, so.
It was a tiny little one.
tiny
Yeah.
little guy.
Okay. Perfect.
um,
Angiomas is another really fun one.
my
I
mom would
have
be great
a
for
one
this.
that comes in on her lip. We did 2 treatments and it's gone.
I love it.
Yes.
Oh yeah, you're right. I need to get my mom in
See
here.
what I mean?
Oh yeah.
Not lying. Is that one right there? Or am I just like seeing things? Right there? Like maybe like, is that one right there? That little line?
I do see some up here, but
Maybe like, is that? Again, like, you guys have better vision than I do. So.
well, sometimes that light too is like creating a little bit of a shine. I see right out there. Okay. There goes. My mom would be so good for this. I need to do my nose with this.
Let me do it for you. Oh yeah, you know what? My nose as well.
I'm doing your nose. So many broken capillaries.
Please, I don't know how not to jump, so you don't know it's funny.
Megan, I'll do yours if you want me to, unless you want to do it to yourself.
I might do it to myself. I don't know.
Would you mind doing it to my nose?
I'll do you.
How do you do it to yourself with the goggles on?
You have to wear the practitioner goggles, like the ones, so it's not as easy for sure. I've done myself, I've done my nose.
Oh, yeah.
Like,
You have
but
goggles
still
on
on my
right now.
nose, little veins, and they just appeared right before my eyes, and so wow.
See, I've done the IPL around my nose, and it helps, but of course it comes back. You know, but you're saying that this is a little bit more long term.
Yes, this is
Would
what
you
you
say?
far deeper.
Okay.
Yes.
Okay. Well, that's exciting.
Yeah, this is the long game. If you
Now,
could-
I'm so sorry. Go ahead.
No, go.
I was gonna say, is there ever a time where you would suggest, like, I'm trying to think, just using this portion of the treatment versus the whole, or do
Yeah.
you recommend doing both?
If somebody's coming just in for veins, that's the protocol here is that just warm up the skin for 3 passes. And
Okay.
you don't have to do the full face, just wherever the veins are.
Okay.
Just warm them up as if you were doing the skin rejuvenation, but only 3 passes, and then go into this. It's sort of being a little bit more conservative just because we did twice that to address the rosacea.
So doing 3 is gonna warm things up,
Yes.
and then go in with this. Okay.
The protocol book, it's literally walks you through everything, and obviously
Yeah,
it's in alphabetical order, except for angiomas are in the back, which first time I was looking for that, of course I was like in something like this, I'm looking for angiomas in the A section, because that's what like logically,
You would think, yeah.
they're back with the veins.
Okay. Now, how many treatments